SB 182. Why should everyone care?
SB 182 would establish minimum nurse-to-patient ratios, meaning the number of patients a nurse can have. This is by far the one thing that would change healthcare for patients and nurses. It would be mandated nurse-to-patient ratios across the board. Every year they reintroduce a federal bill, and every year it dies in the Senate. This bill is now pending in Nevada. It has passed the Senate Assembly, so it has gained some traction, but we really need all the residents in Nevada to go to leg.state.nv.us, click Who's My Legislator, enter your address, you'll find your state senator or assembly member, click on the legislator's name, you'll get their email them, write them at them on social media, tweet them, and do it regularly and tell them they need to support and pass SB 182 because the opposition to that is outrageous. When I tell you every chief nursing officer in the state showed up in opposition. Our state senator, Robin Titus, who is a physician, stood up opposed to it, went on a rant saying that all the hospitals are going to have to close if this gets approved, claimed that it's going to be the destruction of everything. We won't be able to have like rural health care, that there's no proof that it helps patient outcomes, which is absolutely not true. Study after study consistently shows that for each additional patient a nurse has above the recommended ratio for that specialty, all of those patients have between a 7 and 10% increased risk of death or serious complication. So if the recommended ratio is 1 nurse to 4 patients, and you give that nurse, let's say 6 patients, which is very common, that means all 6 of those patients now have up to a 20%, because it's per each extra patient, 20% increased risk of death or serious complications. Now, I don't know about you, but I'm not okay with those odds.